See, cancer don't take no prisoners. Either you're going to eliminate it or it eliminates you. There's no two ways about it.
The minute you're diagnosed, your immune system goes in the basement. I mean, you're in fear.
The cancer rate for American citizens when the war on cancer began back about 60 years ago, the cancer rate in the U.S. was 1 in 8. Today, the cancer rate, reconfirmed again by the director of thoracic surgery for the National Institutes of Cancer, is for females 1 in 3, for males 1 in 2.
What turned out is that I had 10 years ago what they called the fastest moving cancer that they knew of, and by the time we got to biopsies, the cancer was everywhere and had already made it into a lymph node. So the options were surgery and chemo and radiation, et cetera, et cetera, et cetera. When I asked, well, you know, if I do all that, is that going to be the end of it? They said no.
I had breast and uterine cancer diagnosed in December 1990. I said no to surgery, and I survived breast and uterine cancer.
I was around cancer my whole childhood. It destroys a person. The cure for it destroys a person. I really think that we can address this in a different way.
Once these doctors told me what my option was, it just wasn't, I just couldn't do it. It wasn't acceptable. I just couldn't do it. And knowing what I knew, the small amount at that time, what I knew of alternative medicine, hearing miracle story after miracle story.
My name is Gary Wade. I'm a physicist by training. In the early 1990s, I became familiar with Rife technology and the work of Dr. Royal Raymond Rife. He discovered that every virus, bacteria, fungus, rickettsia, protozoa, you name it, that he was able to study with his microscope, he could always find that at least one frequency of mechanical vibration, ultrasound, would kill it exceedingly quickly and easily. He also found that he could kill the common cancers of his time in the 1930s, about 95% of the time, or even better. The 1934 trials, he was given 16 terminally ill cancer patients, and he cured all of them of their cancer. In 1935, they expanded it to the Pasadena Hospital, and a much more expanded number of patients and other diseases, and again, total success. Rife had a 95 to 98% cancer cure rate in the 1930s for the cancers of that time, when the cancer rate was like down in 1 in 20, 1 in 15 range. And the reason he was able to do that was because he discovered that the cancers of that time were teeming with viral-sized particles. One he called the BX cancer virus, and the other he called the BY cancer virus. And he found ultrasound frequencies that would make these viral particles that were swarming inside the cancer cell disintegrate open, releasing their genome and their protein and transcription enzymes and whatnot, and so screwing up the cytoplasm chemistry that the cancer cell would die.
We give a series of 20 intravenous treatments of Mother Nature's natural chemotherapy that is unpatentable, derived originally from the lumber industry. The first 4 treatments consists of high-dose vitamin C in combination with vitamin B17, formerly known or also known as Laetrile, in combination with a full dose of DMSO, dimethyl sulfoxide, which sends it all in better. It has the ability to cross right through the cell wall and straight into the malignancy.
Laetrile is missing B vitamins. The B vitamins are the most quickly destroyed in the processing of food. What do people live on? Processed food. And the B vitamins are the main cause, the lack of B vitamins. And Laetrile is B17.
We also administer sodium bicarbonate. It is also an alkalinizing agent that works very well as a weapon in the arsenal against the cancer. Cancer can only survive in a low oxygen anaerobic environment that is acidic. It is a fungal fermentation process going on at the heart of that malignancy. And when you alkalinize the bloodstream and it goes into the soft tissues of the body, we're treating systemically, the colony breaks up. It can no longer survive.
the healthy system. What happens to an individual cell, just a single individual cell, in a normal lifespan? And then I compared that in cytology, as a lot of people will try to keep it at that high school level, so it's easier understood. But what happens, to compare that to what happens to a disease cell when free radicals come in, the very beginning stage of cancer, the very first cell that divides as a mutation. And there started to become some very recognizable items about that. And so I started looking on the marketplace all over the world for something to take care of this deficiency, something to take care of that deficiency. And over a period of time, I kept good records. I was terrified to go back to my oncologist to find out if I still had cancer 2 years later. And I finally got up enough guts to go back, and I did, and was found that there was no cancer.
Number one, let's look at your food. Let's not feed the cancer. What do cancer cells eat? What do all cells eat? But what do cancer cells grow on? Sugar. Let's get sugar out of your diet. Sugar, carbohydrates, and people say, oh, sugar, that's the ice cream and the cookies. Well, it's actually ice cream, cookies, white flour, bagels, pasta, bread, whatever it is that is processed and not pure and whole.
The lateral story goes back, thousands of years. It's a natural product made from apricot pits. God has put everything on the earth. Good health is a matter of cleanse, and you have to detoxify and cleanse all the time because of what you're getting in the air, the water, and the food. And nutrition doesn't work unless your body is clean enough to accept it.
You have to get on good nutrients. You have to stop the chemicals from coming into your body, get rid of the chemicals that are already there, and you have to go on the right nutrients.
It really all started with my father. My father developed this treatment. Oddly enough, he was trained as a regular physician like everybody else, to diagnose and treat with pills or treatments, whatever, symptomatically. But he had one difference. He had very severe migraine headaches, and he asked his doctors and professors what to do, and they told him, well, it's incurable. Just learn to live with it. But he set out to find a way. He said he can't live with it. He set out to find a way, and it's a long story, but he finally found someone who reported that changing their diet had changed a migraine. That set him off on a change of diet. And when he changed his diet, he recovered. When he then told some migraine patients to change their diet, and they recovered, until one migraine patient said he also had skin tuberculosis, and that went away. So no, that's a different disease. He was trained that way, like all other doctors. And he found that, yes, not one, but 448 out of 450 patients recovered with this therapy. And then he found, when he treated those also by nutritional changes, that it wasn't just the TB that went away, but the heart disease and the asthma and the arthritis and allergies, all diseases disappeared as you were healing the body. And that's how eventually he also found that cancer would disappear and all the other problems.
We looked at the first 18 years of the Gerson therapy and found that 92.5% of the patients that came into the practice were extensively pre-treated, basically had all the chemo, surgery, radiation that they could have, and were sent home to die. And with a patient population that is that compromised, and to have the wonderful results we had with just pure Gerson therapy, and then to look at that patient basis and compare it to the Gerson Plus patients and see that we have at least a 25% increase in overall patient survival rates. That's a huge jump, and that's the reason why I recommend to all the patients to do the full Gerson Plus therapy, because it really works well.
Daniel was diagnosed in January of '02 with a malignant brain tumor. We did surgery, it didn't work. They got 18%. They wanted to chemo him to death, basically. We found poly-MVA, and they found us. He's been taking it for 2 years, 2 months. His tumor is in necrosis state, and he's alive, and that's because of poly and God. and that's the way I feel about that.
One of the things we learned in animals in 1912 was that there were nutrients that could reduce the risk significantly of cancer. The original one was selenium. In the Western world, this was actually in Germany, and we learned that this trace mineral selenium could actually prevent and reduce the risk of certain cancers. 10,000 years before that, the Chinese realized that arsenic, a trace mineral, was a great treatment for certain types of blood cancers like leukemia and lymphomas. And so the concept of nutrients being a preventative and treatment for cancer is not new. We do know that antioxidants are just exceptional nutritional therapies for cancer, and also preventative. For instance, you can reduce the risk of colon cancer with a single multiple. This was a nurses' health study from Harvard Medical School. They looked at 90,000 nurses over a 15-year period. They found that they could reduce the risk of colon cancer by 75%. That's right, 75%. And there's no drug that would reduce the risk of colon cancer by 1%. And then you take the antioxidants that are found in dark berries, such as blackberries and blueberries and black raspberries and black cherries and strawberries. These antioxidants that are found naturally in these dark berries can reduce the risk of colon cancer by 80%, according to the University of Ohio. And so there's an enormous amount of evidence to show that food substances and foods and trace minerals and vitamins can in fact reduce the risk of cancers. And some of them, like the trace mineral selenium, is an excellent choice for somebody who has prostate cancer and breast cancer. Enormous amount of evidence to show this.
And I called a doctor, a naturopathic doctor whom I knew, and I said, do you know any alternative cancer treatments? He said, I've heard of one guy, Dr. Bernardo, but let me check. So he called, said, yeah, he's probably the guy. So I called Dr. Bernardo and I said, what is it you do? He said, call these numbers. He gave me 3 numbers to call. Everybody I called wept over the phone and said he saved my life. Everybody had given me up for dead, and he saved me. And so I called him back up and said, okay, what do you want me to do? He gave me 3 things to do, and he said, as soon as you can travel, because I just got out of the hospital and could hardly walk. This was last May. He said, come down and see me. So I went down to see him. I walked into him. He took one look at me. He says, you're easy. You'll be cured in 6 months. Actually, I was cured in 3 months.
Yeah, my name is Dr. Bernardo. I'm a naturopath, and I treat people holistically, which means I treat the whole body. I use no prescription drugs, none of that. What happens, a patient comes to me with cancer, their doctor or oncologist does what he has to do, and normally the patient comes to me in the final stage of the disease, and many times we can turn them around very dramatically. One of the things that we found out that all cancer patients, their pH is acid, which by this I mean everything in nature has a pH from 1 to 14, 7 being water, blood being 7.2. When we're born, all our intercellular fluids, including saliva, have to have a pH of 7.2 to 7.4. When cancer patients come, or anybody's very sick, they're very acidic. Their pH runs around 5. So what I get the patient immediately, and I've been called a quack for saying this, put the patient on lemon juice and water. Lemon juice is an acid, and when you drink it, it helps to an alkaline tide in the body, so your pH starts going up. Might take 3 weeks to 4 weeks, because you're approximately 80% water. So if you weigh 200 pounds, there's about 160 pounds of water. We have to raise the pH to 7.2. And it's been my opinion that all cancer ceases at a pH 6.8 and it dies at pH 7. Look, they're talking about prostate cancer. Well, we got to freeze it. We got to do this. It needs some nutrients. I've never had anybody that died of prostate cancer. I've had Scripps La Jolla, a Dr. LaChan sent me a patient 6, 7 years ago. His PSA was 4,280. Anything over 4 is cancer. Normally at around 1,200 you die. This was a mean old crabby guy and I should have let him die. But anyway, Dr. Chen said, can you help him? I said, well, how much time you give me? He said, a week. I said, oh, hell, that's plenty of time. He said, Bernardo, get serious. His PSA is 4,280. I said, well, hell, that's no big deal. He said, get serious. You understand English? I said, I'm an American, dummy. 4,280. I said, send him to me. He said, he also got bone cancer. I said, of course, it comes with the territory. I said, what's his alkaline phosphatase? He said, it's over 2,000. I said, no big deal. He said, Bernardo, are you for real? Are you a madman? I said, call me what you want. Send me the guy. When the guy came, he could barely walk. He walked like a 100-year-old guy. Pain, we had to put like 5 pillows on him because of the pain. A week later, his prostate-specific antigen called PSA, which is a marker that identifies the cancer in the prostate, had dropped by 1,000 points. In 5 weeks, his PSA was 0 point something. 5 weeks. Dr. LaChance told me, he says, I find it hard to believe that you can do this, and over here we can't do those things. His pH when he came was like 4.8. At 4.5, you die. Slowly, within 3 weeks, his pH was 7.2. And in 5 weeks, he's completely free of cancer.
My name is Burton Goldberg. I'll be 78 years old next week, and I'm a publisher and known as the voice of alternative medicine. I've had 2 cancers. I had bladder cancer, and just recently I've had renal carcinoma, early stage, and I've taken care of them both with holistic alternative medicine. Well, the bladder cancer, I use Chinese herbs, plus diet, nutrition, and detoxification, and enzymes, German enzymes, proteolytic enzymes. Recently, I had early stage kidney cancer, renal carcinoma, and his oncologist said that I needed a biopsy, but I know enough to know no biopsy. They're not going to come near me with a knife, because when that knife goes in, or the needle, one can spread, and then you hear a year or 4 or 5 years later, oh, we have another cancer. It's not another cancer. It's the same cancer that went through the blood supply that nourishes the tumor or the cancer. So that if you're going to do a biopsy, or if you're going to do surgery, first encapsulate the tumor. Stop the blood supply. It's called angiogenesis. That's what nourishes it. And you then can scoop it out if necessary. But generally, the alternative doctors are able to reverse it without surgery. But if surgery is necessary, first encapsulate the tumor. And that's done with enzymes, like proteolytic enzymes, that eat away the camouflage on the tumor. The tumor coats itself with your blood, the fibrin of your blood. Fibrin is caused by stress. It's the ability to clot. Fibrin coats the tumor. The tumor then gets camouflaged and the immune system says, you're part of me. But when you use proteolytic enzymes, those enzymes can actually eat away the protective camouflage, and then the tumor can be eaten away by the immune system. In my book, Alternative Medicine, the Definitive Guide, that I did with 2 doctors, we have 33 categories of the causes of cancer. And you have to find which of those categories are in that person. You don't treat cancer, you treat the person who has the cancer by finding out what their poisons are, why their immune system has been deprecated, and then you feed the body, and your God-given immune system kicks in and heals. That's how holistic physicians work.
We have on staff down here a medical intuitive who is so sensitive to do this, and she has been over the last couple of years teaching me things to do that, and I try not to rely on that because I'm just really not sold on it yet. But I do know several patients that we've had that even I would say these people can't be here. They've got a week to live. And I have seen with the input of utilizing a medical intuitive person, practitioner, by no medical reason should this guy be alive. Not only was he alive, his cancer was killed. He left 6 weeks later, ready to go back home, find his fiancée and get married. Young guy, 32 years old. Doomed when he got here. Looked like warmed over death. The only difference in therapies, the only thing we did different was to include a medical intuitive to work with him, one-on-one. That's it. There's a lot to a lot of things in this world, and I don't understand them all, and I don't think I should. Miracles, yeah, there's miracles. Common sense therapy, yes, there's common sense therapy. There's a lot of science behind therapy that should not be ignored.